Hello everyone, and welcome to our 2020 Wisconsin Biohealth Awards presentation. Honoring the awardee of the 2020 Hector F. DeLuca Scientific Achievement Award, Dr. Mary Horowitz. Honoring the awardee of the 2020 Wisconsin Biohealth Business Achievement Award, Dr. James Weber. This has always been my favorite part of the annual Biohealth Summit. I wish we were sitting live at the Overture Center in Madison right now in front of over 500 people, but our lives are different now. And even though this is a virtual event, it does not diminish the importance of these awards and how honored BioForward is to recognize the outstanding achievements of two amazing individuals, Dr. Mary Horowitz and Dr. James Weber. We are now in our 6th year with these awards. These are handcrafted awards by our Wisconsin craftsman, Tim Kellinger from Mount Horeb, who created these beautiful awards. During the past 5 years, these awards have been given to other highly impressive individuals that have had major impacts to our communities, our state, and nationally. Past awardees of the Hector F. DeLuca Scientific Achievement Award include Dr. Hector F. DeLuca himself, followed by James Thompson, Lynn Allen Hoffman, Alan Cowley, and Rock Mackey. I stand here at the Medical College of Wisconsin, one of Wisconsin's premier research institutions, to now honor Dr. Mary Horowitz. Presenting to the award to Mary will be Dr. Doug Rizzo. Thank you.
I'm very proud to introduce my mentor, colleague, collaborator, and friend, Dr. Mary Horowitz, the recipient of the Hector F. DeLuca Scientific Achievement Award from BioForward, Wisconsin. My challenge is to give you a glimpse of Mary's career accomplishments in a few short minutes. I met Mary in December 1997 in San Diego at the ASH annual meeting when I interviewed for a faculty position in the International Bone Marrow Transplant Registry. The IBMTR was an outcomes registry that collects observational data about BMT recipients performed around the world. I remember being impressed and wondering if I was anywhere near impressive enough to get a job offer. I received the job offer, and little did I know I was catching a rising wave. Mary joined MCW and the registry around 1985 and became the chief scientific director of the CIBMTR in 1991, a position she's held for nearly 30 years. Her story is a story about big data. That term's relatively familiar in bioscience these days, but in 1991, the concepts of big data had hardly reached kindergarten. Mary had the foresight and innovation to realize what big data was and what it could mean for scientific discovery long before it was fashionable. She understood the collaboration and resources needed to collect data, organize and prepare it for analysis, maintain and update the IT systems, develop biostatistical expertise, and analyze data to advance medical science. She also realized the value of pairing biospecimens with robust clinical data to further enhance research discovery, and the value of using observational real-world data to plan clinical trials and estimate clinical trial accrual. That insight inspired the innovative resource we now know as the CIBMTR, a major influence in the international cellular therapy domain. Some accomplishments that have occurred under Mary's direction that describe that influence. In 1990, there were about 22,000 total patients registered in the database. By 2019, there were 22,000 patients registered annually with an overall size that was more than 545,000 recipients from more than 450 participating centers. Mary's CV lists more than 400 publications, but that underestimates the true impact in our field. The resources of the CIBMTR have led to more than 1,450 peer-reviewed publications since 1990. And in one recent 5-year period, we estimated that there were more than 1,000 unique authors from more than 450 institutions reflecting in our published registry studies. You've heard that Mary's been continuously funded since 1990 with NIH support. I focus on NIH funding because that's the easiest to quantify and is peer-reviewed. Mary's total lifetime NIH funding exceeds $300 million, and that's just part of the funding that has sustained this organization. In 2019, she was the faculty member with the most NIH funding at the Medical College of Wisconsin, the second highest in Wisconsin, in the state of Wisconsin. And if I perform my search correctly, she's the 108th worldwide overall to receive NIH funding in 2019. Mary's innovation led to several important new programs, including an NIH-funded clinical trials network with nearly 12,000 patients accrued on at least 55 studies from more than 125 centers since 2003. And there's been more than 115 scientific publications from these clinical trials. CIBMTR has influenced and competed for the contract with the US government to run the stem cell therapeutic outcomes database. This database supports the US hematopoietic cell transplant program, and the CIBMTR has held that contract since 2007. Mary's had oversight of a large biospecimen repository for observational database recipients and clinical trials recipients that's become an invaluable resource for clinical investigators. And the most recent program is an NIH-funded cellular immunotherapy registry that in 3 short years has collected information from more than 3,000 recipients of CAR T-cell therapy from more than 125 centers. She's developed research collaborations with international registries in Europe, Japan, Asia, the Mediterranean, and Canada. I think it's safe to say that the outcomes registry that Mary has built and her scientific expertise have become world-renowned. I imagine nearly every clinician in our field knows Mary's name, and she is highly sought after as a speaker, advisor, and trusted colleague throughout the world. How did she do this? I don't have time to explain in detail or offer some of the funny stories I would offer about Mary that describe her exceptional leadership, but she's absolutely driven to excellence. She's passionate about mentoring, and you can't achieve all this success by yourself. You have to collaborate. I'm fortunate to be one of her mentees, as are a whole group of clinician scientists in the United States and around the world. And Mary's passion for mentoring has been recognized with several mentorship awards, including the ASH Clinical Research Mentor Award in 2011. You can't be at the CIBMTR without learning how to be a collaborator. And I think every one of us who have worked with Mary understands or has come to understand the value of collaboration. And it's a hallmark of how this registry has developed the excellence it's had. And finally, I'll say that there's an incredible amount of humility. I'm pretty certain you'll hear from Mary, and she'll emphasize the shared nature of these accomplishments and how so many others should receive credit. Of course, that's true. These do represent team accomplishments. But let's acknowledge that teams need strong leaders, and Mary is absolutely such a leader. I'm proud to work with Mary. I'm privileged to share in the success of this organization, and happy to introduce you to such an accomplished scientist. Thank you. Congratulations, Mary.
Thank you. That was beautiful. Thank you, Doug.
You're welcome.
I'm almost speechless, which doesn't happen to me very often. You know that I appreciate not only those kind and generous words and all the work you put into this, but our many years of collaboration and friendship. I may have started as your mentor, but I definitely have learned at least as much from you as I gave to you. So thank you again. I am really honored by this award. I have to tell you that I completely overlooked the initial email about it because I thought I was being asked for nominations, not being awarded it, because it never occurred to me that I would be considered in the same category of the person for whom it's named and the people who have received it since then. I still can hardly believe it, but I am truly grateful. You know, I didn't start out as a child wanting to be a doctor or a scientist. You know, I grew up in a different era, you know, and girls didn't really think about those kinds of futures. When I went to college, I was going to be a teacher. I was going to focus on children with learning disabilities. There are days when I feel like that's where I ended up, but not usually. I developed a friendship with a biochemistry graduate student. And I used to meet him in his lab. You know, we'd be on our way to some party or another. And I got in the habit of asking him about his work. And he said I would grill him about his work. I was fascinated. I was particularly fascinated about the implications for human health. One day he looked at me and said, "You shouldn't be a teacher. You should be a doctor." And all of a sudden a light went on in my head. I said, I could do that. So I was in a very innovative independent study program where we could do a lot of hands-on learning. So I asked the person who ran the study if I could get a position in a lab, and I ended up in a laboratory at the University of Buffalo, a molecular biology laboratory, with a wonderful scientist by the name of Miriam Weiser. And my fascination with science grew. And I saw that she had a husband, she had kids, and one day I said to her, "Can you really have a career and a family?" And she didn't even understand the question. She looked at me and said, "Why not?" Indeed. And so I actually then decided I would go to medical school. Well, I did find out that there were a lot of people with long lists of why not at the time, including my parents, who were sure that it was going to doom my young marriage. And in fact, the first person who interviewed me for medical schools took the entire allotted time explaining to me why women did not belong in medicine, including the classic line that I was taking a job away from a man. And another person who interviewed me wanted to know what my husband thought about me going to medical school and whether I intended to have a family. Well, to the first question, I could say with no reservation that my husband was entirely supportive. And, you know, we choose our partners in life very young and for emotional, not logical reasons. We don't know until we're older how important it is to be with someone who shares your dreams, shares your values, and will support you every step of the way. But my father also always told me that it's better to be lucky than smart. And I have been very lucky in that choice and have never, and have been grateful for it for the past 46 years. To his second question, which is whether I intended to have a family, didn't ask for any particulars, so I just said, yes, we intended to have a family. Although I was 3 months pregnant at the time, I didn't tell him the timing. And so in 1976, I started medical school with an 8-week-old son, whom my husband and I brought to the freshman welcome dinner because we couldn't find a babysitter. And he was a big kid. And although I had a lot of arguments against going to medical school before I started, I have to say that I've spent my whole career here at the medical college, and I have never felt anything but supported here. I went to medical school instead of graduate school, in part because I just didn't want the pressure of writing papers and getting grants. Well, that didn't work out. I became addicted to academia. I love the spirit of inquisitiveness and discovery. I love thinking about solving problems in a way that would make life better for a lot of people. Of course, clinical medicine is problem solving too, but it's the problem on the person right in front of you. I love that too. But I like being part of the bigger picture as well. I also found out that I like writing papers, and I love writing grants. Nothing gives you more focus, clarity of vision than trying to convince someone to give you money to do what you want to do. And although I love my undergraduate laboratory experience, I also knew I wanted to do clinical research. But you know, medical training it's a little better now. It doesn't give you a lot of background on how to do research. You know, I didn't have any analytic skills. The only stats course I'd ever taken was a basic stat course in medical school. So when I joined the faculty in general medicine here, intending to do epidemiologic research, I enrolled in NCW's master's program in biostatistics and clinical epidemiology. And that is where my life changed. That decision to enroll in graduate school was the biggest decision of my professional life. Turns out that the Division of Biostatistics was the home of the International Bone Marrow Transplant Registry. And just a one-liner on BMT, bone marrow transplants are done to replace marrow that's been destroyed by either disease or a disease's treatment with healthy marrow. And the first successful transplants were actually done in Wisconsin and Minnesota in 1968. So the field was really in its infancy. But when I joined in 1985, there were fewer than 10,000 transplants that had been done anywhere for all of that time. I have to say that, you know, those first two transplants that were done in two young boys with immune deficiency diseases, boy in the bubble diseases, were published in the same issue of Lancet. And there's been a continuing rivalry about which one was actually first. Just another Wisconsin-Minnesota rivalry. Mort Wharton, who was involved in that first transplant at UW and was now at the Medical College of Wisconsin, was the scientific director of the IBMTR. And Al Rim, who was the head of biostatistics and my graduate school advisor, did all the stats for IBMTR at the time. And they were both eager to get an MD graduate student working on their database, and so suggested that my master's thesis should focus on transplant. Let me just say, I had no stats background. I wasn't a lover of big data at the time, but I did fall in love. I loved analyzing data. I loved getting that data to tell me its truths. And I love BMT. It's a wonderful field of hematology, oncology, immunology. It's a therapy that's used to treat life-threatening diseases in people who don't have any other therapeutic options. So when Mort and Al suggested to me that I had kind of a knack for this kind of work, and maybe I should consider it as a long-term career option, I jumped at the chance. Of course, I did really want my clinical work to be in the same area as my research work, so I went back, I did a fellowship in oncology focusing on BMT. So I've been not only a BMT researcher, but a BMT clinician for the past 30 plus years. When I joined IBMTR, I was the 8th person on its staff. We were pretty small, and that year we had a big party because we entered the 5,000th patient into the database. But we had a global network of partners who helped us analyze the data that included all of the pioneers in transplantation. Those people were very generous in their time, not only for doing studies, but in mentoring me, and I will be always grateful for that. I learned a lot of clinical BMT by reviewing all those data forms. One of my jobs was to review every form that came in, and there were hundreds a year. And I learned one thing, that someone somewhere will do almost anything. And I learned a lot about different approaches to different problems, and then I spent hours at the computer trying to rigorously distinguish between what worked and what didn't work. With my work, very aggressively critiqued by my mentors, who had a much better understanding of whether my findings made clinical and biological sense. It was a great time of learning for me. When I started in transplantation, only patients who had suitable donors, same tissue type, same HLA type in their family, could get a transplant. But in the mid-'80s, we were starting to do transplants using marrow from unrelated volunteers. And people were starting to establish big panels of unrelated volunteers. Because while you have about a 25% chance of having the same tissue type as a sibling, the likelihood that anyone listening to me today has the same tissue type as me is less than 1 in 100,000. So you need a lot of people to sign up. And in 1986, the National Marrow Donor Program, now also known as Be the Match, was established in Minnesota in Minneapolis to be the US donor registry. They also established a research program to track the outcomes of the transplants that they were facilitating. Now we had two registries doing similar overlapping work, another Wisconsin-Minnesota rivalry. But as the field grew and as our research programs grew, we soon realized that we were collaborating a lot more than we were competing, and it was a good collaboration. And so in 2004, the National Marrow Donor Program and the Medical College of Wisconsin signed an affiliation agreement that integrated our programs and gave us an even longer acronym, CIBMTR, for the Center for International Blood and Marrow Transplant Research, thus losing a great opportunity to have a pronounceable name. CIBMTR is a lot different in some ways than the IBMTR I joined. We now have more than 200 faculty and staff across the two campuses, and as Doug pointed out, more than 500,000 patients in the database. No one could learn transplant by looking at all the forms, since there are more than 20,000 a year. And we have programs in outcomes research, immunobiology. Doug mentioned the clinical trials programs. We have a big focus on survivorship and quality of life. But our essence has not changed. We share data. The community shares data with us, and we share data with the community and expertise. The community shares their expertise with us, and we share our expertise with them to figure out how best to apply transplantation and now non-transplant cellular therapy to save lives. I can tell you, though, a couple of big things that have changed, and one is the attitude towards data. Doug alluded to this in his talk. Whoever heard the terms real-world data outcomes research in the 1980s, those terms didn't even exist. And there was a lot of suspicion of research efforts like the registry. It was as if computers corrupted data instead of providing clarity to data. If I got a review back on a paper and it started with "this is a registry study," that was a derogatory term. I knew it was rejected. Now, if I get a review back and it starts out, "this is a large registry study," I know I have a good chance that it was accepted. We now not only have a computer on every desk, we have a computer in every pocket. People want data, and the more data, the better, and they want it when they want it. And I am really proud to say that investigators, both in academia and in the biomedical industry, look to the CIBMTR as a source of not only a lot of data, but a lot of high quality data and a lot of expertise on how to analyze this data, which brings me to another thing that has changed, and that is the growing importance of public-private partnerships. You know, BMT grew up in a different era when there was not a lot of regulation on clinical research, particularly clinical research involving human cells. A lot of people say it would never gotten off the ground today. I don't know if that is true, but I do know that although academia is irreplaceable as a critical resource for innovative science and innovative therapies, it requires good partnerships with the biomedical community, with biomedical industry to bring those therapies to the people who need them. And a really good example is something that Doug also mentioned. We didn't even know each other's talks beforehand. Is chimeric antigen receptor T cells, CAR T cells. Now, for CAR T cells, you take immune cells from a patient, you genetically manipulate them so that they can better recognize the patient's cancer, and then you put them back in. It's a really important advance in cancer treatment. The idea, the science, came from years of work in academia, but making those therapies available and further refining them required partnerships with companies like Novartis and Kite Gilead, who have the first FDA-approved commercial CAR T-cell products. And I'm really proud to say that the CIBMTR is partnering with Novartis and Kite Gilead to do the FDA-mandated 15-year follow-up for patients who receive genetically modified cells. And we are now starting to make these data available to the public to do the kind of practice-changing research that CIBMTR has done in transplant over the past almost 50 years. I just want to end with gratitude. You know, I stand on the shoulders of giants. It was the pioneers in transplant who established the IBMTR with a vision for the future. And I am grateful to have been able to follow in their footsteps. I am grateful for all the support I've had from the Medical College of Wisconsin and the National Marrow Donor Program. I'm incredibly grateful to work with people like Doug who lead our scientific programs. I'm grateful to all of the centers around the globe that do the hard work of generating and submitting the data for our databases. And I'm really grateful to the patients who agree to share their data to help others. And finally, I am really grateful to you for acknowledging this work. Thank you.
Thank you, Dr. Horowitz, for your numerous research achievements, your dedication to improving the practice of hematology oncology, and for your leadership in paving the way for the next generation of clinical scientists. And from your presentation, thank you for all your contributions that we benefited from, because you had the courage not to let others determine your course in life just because you're a woman. Thank you. As you can see, I'm in a new location to honor Dr. James Weber, CEO of Prevention Genetics, Marshfield, Wisconsin. We all have had to pivot these days during the pandemic. Since we couldn't be at the Overture Center, we traveled from Madison to Milwaukee, now to Marshfield, to honor these remarkable individuals. And our travels now bring us to Prevention Genetics, founded by Dr. James Weber. Jim follows a strong tradition of other business leaders that have been recognized for their business and leadership achievements. The previous awardees of the Wisconsin Biohealth Business Achievement Award include Bill Linton, Ralph Caunton, Cynthia LeConte, Kevin Conroy, and Laura Johnson Douglas. In the 6th year of our awards, we now honor Jim Weber. Presenting the award to Dr. Weber will be Randy Lambrick.
Thank you, Lisa. It's great to be in Marshfield, Wisconsin at this beautiful building, Prevention Genetics. Hello, everybody. My name is Randy Lambrick, and as a board member, BioForward board member, and member of the award selection committee, I have the distinct pleasure and honor of introducing Dr. James Weber from Prevention Genetics, the president of Prevention Genetics, as the 2020 recipient of the Wisconsin Biohealth Business Achievement Award. I need to disclose in front of Jim that I've had an admirable and somewhat covetous attitude towards him as long as I've known him, short of stalking. But when it comes to his ability to pursue a scientific and academic career, which has been very successful, in addition to the bold initiative he took as the founder and president of a global biotech health company in a really competitive world of genomic medicine, it's outstanding. And I'm honored to be able to introduce him. So let me tell you a little bit about Dr. Jim Weber, and then I'll say a few words about Prevention Genetics. Dr. Weber grew up actually in Milwaukee, attended St. Francis High School, and then went on to UW-Madison, receiving his Bachelor of Science degree with honors in chemistry. He then went on to complete his PhD in biochemistry at the University of California, Berkeley. His research interests were focused at UW in molecular biology, where he modeled the building of nucleic acids, especially tRNA. And at the University of California, he focused on the purification and characterization of chromatin fragments containing satellite DNA, and then came back to UW for postdoctoral research with Dr. Jack Gorski, investigating repetitive DNA structure and DNA methylation of the rat prolactin gene. Jim went on to be a principal investigator at Walter Reed Army Institute of Research, investigating the molecular biology of human malarial parasites prior to moving back to Wisconsin and going to Marshfield, where he served as a senior research scientist in human genetics. In 1994, Jim became the director of the Center for Medical Genetics at the Marshfield Medical Research Foundation, where he served in that position for over 10 years, in addition to leading the National Heart, Lung, Blood Institute Mammalian Genotyping Service program there. And then about 10 years later, in 2004, Jim founded and served as president of Prevention Genetics, and located it in Marshfield, Wisconsin. He still holds his academic appointments and is a member of the Board of Trustees for the Marshfield Clinic Research Foundation. His scientific honors and achievements are just too numerous to mention, but if I could highlight a few here. He has received fellowship awards from the American Cancer Society and National Institutes of Health. He received the Army Commendation Medal for work on the malarial protein gene. In 2003, Lancet nominated his paper of the year that was published in Science. In 2012, Marshfield Clinic awarded him the prestigious Heritage Award. He holds several patents in genetic sequence methods, serves on numerous federal and scientific study panels, advisory boards, and review committees. And he's authored over 225 publications in high-impact journals such as Science, Lancet, Nature, Nucleic Acid Research, and et cetera. During Jim's entire research career, he has been totally committed and passionate not only towards advancing genetic science, human genetic science, but translating it into better patient care, clinical care. And he has done that through his company, Prevention Genetics. So let me just say a few words about this awesome company in Marshfield, Wisconsin. It's a 16-year-old global company, which is CLIA and ISO accredited, certified. It's a laboratory that delivers quality clinical genetic testing worldwide, including direct-to-consumer testing. Prevention Genetic employs just under 200 individuals, really talented people, many with advanced degrees. Prevention Genetics and its staff are involved with genetics education, working with STEM programs, high schools, job shadows, and universities throughout the state. It's a valuable industry in Marshfield, which I think has a population of under 20,000 for those of you who've never been here. But as a company, it's provided support to numerous local organizations through its charitable contributions. Prevention Genetics continuously expands and updates their genetic testing menu, introducing new technologies and efficiencies to aid in not only the disease prevention, but clinical decision-making processes. Long ago, Jim realized that long-term storage of DNA biobanking was also important to understand a person's health and on a population health level. And he's been a pioneer in the biobanking arena. Prevention Genetics' mission is to improve life through genetic testing. And Dr. Weber's vision, formed early in his academic career, has now blossomed into a formidable global biotech company. And he's accomplished this all in a rural town in central Wisconsin. As one of Jim's employees stated, Dr. Weber is one of the smartest and most productive people I know. And I'm sure everybody who knows him, including his staff, believes that, including his wife and 2 children, who all agree that Jim is a driven pioneer in preventive genomic medicine. So it gives me great pleasure to introduce Dr. Jim Weber as the 2020 Wisconsin Biohealth Business Achieve Award recipient. Jim, would you come forward?
Thank you, Lisa, and thank you, Randy, for that generous introduction. And thanks also to all of our great Prevention Genetics employees who do all the work. I'm both surprised and humbled by this award. Surprised that it didn't go to someone in the southern part of the state, and humbled because I know there are many other worthy recipients. I've lived in Wisconsin all but about 10 years of my life. I'm a loyal Badger. I've been pleased over, especially about the last 40 years, to watch the growth, the great growth of the biotech industry in our state. And I've been very pleased to see that, and I hope that growth can continue and even accelerate. So what do we need to expand our state biotech industry? Well, I certainly don't have all the answers. But maybe I can identify a few factors that I think are important. First, as I think we all know, we need to keep our universities strong. And I refer not just to our major research universities in Madison and Milwaukee, but also to all the other campuses sprinkled throughout the state. So Prevention Genetics has employed and continues to employ many graduates of UW-La Crosse, UW-Stevens Point, and UW-Eau Claire, just to name a few. We also, of course, need capital. We want to capture our share of all the capital that's sloshing around the company in the world. But I think we also need to do a better job, a much better job of tapping capital from our own state of Wisconsin. So it turns out that Wisconsin residents do a pretty good job of saving for retirement, better than people in other parts of the country. But almost none of those dollars are invested back in Wisconsin. So they go to places like California and Massachusetts and Texas, and that's great for the people living there, but it doesn't really help our own residents. So I'd like to see maybe a couple of new laws passed in Wisconsin. The first one would be a law that would require all companies that offer 401k or similar retirement plans to their employees to offer a Wisconsin investment option to the employees so that they can put away a little portion of their retirement savings in Wisconsin companies. Second, and this is not a new idea, but I think it's a very good one, I'd like to see a fraction, a small fraction, but significant, maybe 5 or 10% of the funds that are overseen and invested by the State of Wisconsin Investment Board invested in Wisconsin companies. So the Investment Board has control over a number of funds, particularly the retirement funds of state employees, and their fund balances now are over $100 billion, so substantial amount. But again, this money is not invested in the state. I don't think it's too much to ask for employees, state employees who receive salaries from the taxpayers of Wisconsin, to return a small fraction of their investments, of their retirement funds, back into state businesses. And I also refuse to believe that Wisconsin businesses can't generate just as good a return on investment as companies in other parts of the country. Finally, we need to bring back to Wisconsin as many as possible of the large numbers of natives that are now living and working in other parts of the country. So as we all, I think, know again, many graduates of our fine universities are now living and working in other parts of the country and world. Personally, I've known quite a few young people who've grown up and gone to school in Marshfield, really talented young people that are no longer working in our state. I think many of these people would jump at the opportunity to come back to Wisconsin, to be closer to their roots, and especially to their families, if, of course, they had the opportunity. They need, of course, good jobs. They also need career opportunities. And so I very much like to see our state universities and private businesses in Wisconsin work very closely together to try to lure as many of these people back to our state as possible. Thanks again to BioForward for this wonderful award.
Thank you, Randy. And of course, thank you, Dr. Weber, for your contributions to advance our industry, to improve our lives through genetic testing, for your community support to STEM education, and for founding and growing Prevention Genetics in Marshfield, and of course, your positive impact on human health. This concludes our 2020 BioHealth Awards ceremony. We look forward to continuing this tradition by honoring 2 more individuals in 2021. Stay safe, everyone. Thank you.